Today we're looking at the vas deferens. So what we have here is a section of the spermatic cord. So the vas deferens is found within this whole spermatic cord, and if you remember, the spermatic cord has many structures within it. I think more than or about 10 structures within it. So at low power we can see many structures within it. These include the vas deferens, which is what we'll look at in detail, and there's what we call a pampiniform plexus of veins, and testicular artery, cremaster arteries. We also have the genital branch of the genitofemoral nerve. I'll show you nicely the nerve structures, but we won't really know for sure if it is the nerve in question, because we need to look at it on a gross anatomy perspective. But on histology, I'll show you the nerves as well, and if we're lucky, we'll get to see a cremaster muscle. It's skeletal muscle with skeletal muscle fibers. It also consists of the tunica vaginalis, which is just connective tissue and surrounding fat here, which we have here. So now, just a quick clinical correlation about this spermatic cord, because I think it's of importance. It's that in testicular torsion, meaning in twisting, so when the spermatic cord twists, okay, so what happens is that you compress the pampiniform plexus, which is the vein that drain the testis, and you reduce blood flow away from the testis, and can potentially cause hemorrhagic necrosis of the testis, which is what we commonly see in clinical practice. But anyway, now let's look at the vas deferens, because that's what we came here to discuss. So this is just a higher view of the vas deferens here. So I'll highlight it. You can see here it's very muscular. Okay, so zooming into the vas deferens, we can see the innermost layer is lined by a pseudostratified epithelium with stereocilia, which is almost similar to the epithelium that we see in the epididymis. So the basal cells are located at the base of the epithelium, and then beneath the epithelium we get to see a fibrotic lamina propria. So it's really fibrous, it's loose and very thinned out. And then adjacent to that or beneath this lamina propria, we get to start to see the smooth muscle fibers. So it consists of 3 layers. Okay, so the layers are an innermost longitudinal layer, which is this layer here, and then a middle secular layer, which is this layer. You can see there more from the way it was cut, and an outer longitudinal layer, which is this layer here. Okay, and as I'll keep mentioning, how we know that this is smooth muscle is when you look at the nuclei, they have a cigar shaped appearance. So this is innermost, middle, outer. Okay, so secular, longitudinal, and inner secular. So you can see the muscle fibers, how they move, and here, because of the cross section, the way it was sectioned, the cutting is why they appear secular on H&E sections. So now the outermost layer of the spermatic cord is lined by an adventitia. So in histology sections, the lumen may appear irregular of the lumen of the vas deferens may appear irregular, but in this section it's not irregular, but it's still normal because we looked at the epithelium. We didn't see any issues with the epithelium. So the most common clinical lesion in the vas deferens is a benign small cyst, and these usually arise from the mucosal epithelium due to obstruction of the lumen, which can result from minor congenital narrowing of this and previous inflammation or trauma. So they are typically asymptomatic, but you can find them from time to time. So anyway, in conclusion, within the spermatic cord, we have the vas deferens. Okay, very thick walled, composed of 3 muscular layers, and the luminal area is lined by pseudostratified epithelium with stereocilia. Okay, and it has this muscular wall which is designed to contract and propel the sperm. So understanding all the structures may help you in understand any pathological event that occurs either in the vas or in the testis. So if you have any more questions, you can feel free to pop them in the comment.